Good afternoon. County Executive Rich Fitzgerald here with Dr. Deborah Bogan from the Allegheny County Health Department, giving our weekly update on COVID-19 pandemic. We were delighted today to be joined by Governor Wolf, who came to town today with some of his team from the administration in McKeesport, as we are opening up another clinic, vaccine clinic in the community, joined by Dr. Bogan, some of our state representatives, Senator Brewster, Representative Davis, Mayor Shrepko, and really want to thank Reverend Coleman for opening up her facility, her church, to folks in the community. And I think the message from Reverend Coleman, along with everybody else who was there today, is to encourage people to get the vaccine. Now that we're in 1B, and on Monday we go into 1C, and then on the 19th, everybody is eligible. The good news is we now are over 700,000 shots in arms here in Allegheny County, and we certainly anticipate that number to even ramp up even more. The announcement today that you saw that AHN will be holding J&J, a good-sized clinic later this week in Monroeville, and that UPMC will also be doing a pretty massive clinic, again with J&J, up in Fraser Mills. So we're starting to get a lot more folks vaccinated. The fact is over 75% of our over 65 population has been vaccinated. We still want to work on that and improve even over the 80-year-old cohort as well to get those out there. But there are now 4 clinics open that the county itself is doing. The one in McKeesport that we talked about today, the one in the Hill District with Reverend Grigsby and his team, the one in Castle Shannon, and one in Ross Township. Also want to congratulate the governor. The CDC came out with their rankings, and Pennsylvania is number 1 among large states in getting the percentage of shots in arms. And that takes a lot of cooperation, an awful lot of partnerships, and that's really been the great thing that we have seen throughout this pandemic, vaccine and even pre-vaccine, how so many people have been willing to help and step up and be part of a solution. We have volunteers, retired doctors and nurses who are injecting people, giving the vaccines, and that's the kind of partnership we're going to need to defeat this virus. Along those partnerships, we talk about institutions and we talk about individuals, but we need the partnership of all of us, because we know the cases, positive cases, are much higher than they should be. And a lot of it is because of gatherings and other things where some folks are getting a little bit relaxed. And we all know about COVID fatigue, and we're tired of it, but we're almost there. We might be weeks or maybe a month or 2 away from really getting to the point that we need to be. So let's continue to work together in partnership, keep the cases down, wear your mask, distancing, get that vaccine as soon as you're eligible, get signed up, and get those shots in arms so we can get everybody protected and back to a normal operation that we would all like to see. So for now, thank you, and let me turn it over to Dr. Bogan for her weekly report.
Good afternoon. Thank you for joining us. For the past 13 months, the county executive and I have provided updates on the local impact of COVID-19 on our community. It's with a heavy heart that I report that we are well into our 4th wave of cases here. Case counts continue to increase. We're back where we were in early January. And over the last several days, daily case counts have set records for 2021. Our positivity rates have also increased another percentage from last week, and it is now 8.8%. Hospitalizations continue to increase slowly, and deaths had steadily declined from mid-December, reaching a nadir the week of March 14th, but sadly increased for the first time in months the week of March 21st. I don't expect cases to decline at least for a couple of weeks, and we know the cause. Large gatherings combined with no physical distancing or masks mixed with the variant viruses in our community. The next few months are the final push, and we must all exercise self-restraint. This is not the time to give up. Vaccinations are proceeding at a fast pace and should increase significantly in the coming weeks, especially since we received our first large shipment of the Johnson & Johnson, also called the Janssen vaccine, to the county this week. More good news, as of last Friday, as the county executive said, more than 75% of the county residents age 65 and older, and 44% of those age 50 to 64 had received at least their first dose of vaccine. This is important because when we consider who is most at risk for the most severe impacts of COVID-19, it is our older population. On top of all that, eligibility for vaccination is opening even wider. We are currently vaccinating those in phases 1A and 1B. Next week, we open to 1C, and on April 19th, we open to all those 16 and older in Pennsylvania. To meet the growing population of those eligible for vaccine, we and others are opening new, large, and small clinics. Earlier today, with Governor Wolf, our county executive, and other distinguished guests, I toured our new vaccination clinic at the Bethlehem Baptist Church in McKeesport. Throughout the pandemic, Reverend Coleman and her congregation have answered the call and helped their community, and now they're helping the health department and their community, the health department to bring vaccines to their community. So I want to thank Reverend Coleman and thank her team for their hospitality and their work. And I also want to thank the McKeesport Area Rescue Service. They are taking the staffing lead at that clinic. As with our other EMS partners, they bring medical expertise and experience serving the residents across our county. Not every vaccination clinic should be the same. Some are very targeted efforts, like those in our senior buildings and centers, where we vaccinate anywhere from 20 to 150 individuals. Some, like Central Baptist and Bethlehem Baptist, can accommodate a few hundred people a day and are ideal for a more focused service. Others, like the Ross and Castle Shannon clinics, are textbook examples for emergency preparedness, where we serve about 1,000 people a day. And then there are mass vaccination clinics, which can serve several thousand each day. Starting this week, several mass vaccination clinics are opening. We, along with Allegheny County Emergency Services, teamed up with the two largest healthcare providers, Allegheny Health Network and UPMC, which are opening mass vaccination sites on alternating weeks. AHN will host its first clinics at Next Tier Connect in Monroeville on April 9th and 10th. UPMC will hold a drive-through clinics on April 14th and 15th at the Pittsburgh Mills in Allegheny Valley. AHN and UPMC will administer about 12,000 doses of the Johnson & Johnson vaccine each week at these clinics. The simultaneous expansion of eligibility and the opening of mass vaccination clinics is by design. And while AHN and UPMC run these large sites, the health department will continue to focus most of its attention on filling the gaps and meeting unmet needs. Over the last several weeks, I've talked about reaching people who are homebound. And with the arrival of Johnson & Johnson, we're activating that strategy. UPMC and AHN are both working with their patients who are homebound to distribute the J&J vaccine. Additionally, together we're working to identify other truly homebound individuals to make sure they're also protected. I look forward to providing more updates as this work progresses, but I'm pleased it's underway. Again, beginning April 19th, all people 16 and older are eligible, and I encourage all to use our new vaccination registration system or sign up through another vaccine provider. As we reported, the transition to our new registration system created some data challenges related to the transfer of records from the old to the new system, and then registering those individuals for a second dose. We are working to eliminate any outstanding challenges, but I'm pleased to say as of today, we expect to successfully achieve the goal of scheduling everybody or anyone who wants an appointment. And to date, over 20,000 people have successfully used the tool to register for an appointment, and nearly 9,000 are pre-registered and waiting to become eligible. So as always, my broken record self, please follow the essential mitigation strategies we've talked about week after week. Please wear your mask, keep physical distance, and wash your hands. Also, please be safe and be kind. Thank you.
The first question that we have is from WESA. Could you give us an update of how many cases of B117 have been identified in Allegheny County? And for those listening, could you explain what B117 is as well?
Sure. B117 is the UK variant of the virus. Those are the numbers used. So we don't know, we know how many variants we have. What we don't know is how many are being sent for testing. So we don't have what we would call the denominator, so we don't know what proportion of cases are the variant. We know that as of the other day, there were 75 cases confirmed with a variant. Almost all of those were the UK variant. And again, most of that's handled by the state, so we don't have the number to know what percentage of those that were sent for tests actually came back with the variant.
This next question is from the Post-Gazette and is a long question, so I'll be happy to repeat anything. Research shows that people with dementia are more likely to contract COVID-19, be hospitalized, and more than 3 times as likely to die from the disease than those without dementia. And state data shows that personal care homes with secured dementia units were more likely to have large outbreaks than those without dementia units. In the county health department's experience in long-term care facilities in Allegheny County, have you and your staff seen a significant impact of COVID-19 on residents with dementia? And if so, can you describe what you and your staff have seen and why you think there has been such an impact on long-term care residents with dementia?
Yeah, that is a long question. So dementia, we certainly saw, particularly early on in the pandemic, the impact of COVID on long-term care facilities, including personal care homes and places where people with dementia live. Dementia is a challenge because it's very hard to keep people wearing their masks and following the guidance for COVID in dementia units. So we don't have any specific data for the county on dementia patients or in personal care homes specifically, but we know that dementia has been a challenging, patients with dementia have been challenging for people in long-term care to manage because of the challenge of keeping them in their rooms, keeping them wearing their masks, and following the guidance.
The next question is from WTAE. While vaccines appear to be becoming more available and both the President and the State Department of Health have set their dates for opening up appointments for more people, we'd like to know what challenges the Health Department continues to face when it comes to getting people vaccinated and what might need to be done to overcome those challenges.
Yeah, so I think, there has continued to be confusion because we don't have a single registration system across the county or the state, and so people have to go to multiple locations to sign up. I think that challenge is reduced a lot because there's much more availability of appointments than there had been and much more availability of vaccine. But I do think that for some that remains a challenge. Also, one of the challenges I think we've improved a lot is the ability for people to call in for appointments and schedule. I know that the state has required that of all vaccine providers, and that has improved. And then of course we've all talked about vaccine hesitancy, particularly in the, what we're seeing is in the young adult age group for vaccine hesitancy. And so I think that's the challenge we all need to face. We don't want to get to the point where we have lots of vaccine and people who don't want it. So I think we all need to continue to work on that together.
This next question is from Print. What is the percentage of tests being tested for variants, and what percentage of those tested are variants? Which variants are they?
So I think I already answered that in that we don't know how many are being sent for tests. That's mostly being handled by the state. There are some private laboratories in the area that are sending the samples for the variant as well, and I think that will increase over time, but right now I don't actually have those data. I'd refer you to the state for a better answer.
This next question is from the Post-Gazette. Some local clinics have reported having trouble filling their open vaccine appointments with individuals that are currently eligible in the state's 1A and 1B categories. Is this a concern for you?
So I think, our experience has been that our clinics are still filling, but they're filling a little bit slower than they were. I think there are a lot more options out there for people, more pharmacies, our FQHCs, our healthcare providers, our large events have increased, which is great. The other thing is that the eligible population, 1A was an enormous population in the state. We estimated it to be somewhere between 30 and 50% of all of our population were eligible for 1A. And the 1B is not that much of a big addition, And so I think that's what's going on, but we are still filling our clinics at this time.
This next question is from WTAE. With the weather turning warmer, what is your message to the people of Pittsburgh as they start heading outside more?
Well, I think, first of all, it's great to see, as the weather breaks, so many people that are out there. And as Dr. Bogan said, we encourage people to go outside, to be, whether they're in parks or the trails or other things. But just because you're outside in nice weather doesn't mean you don't have to wear your mask, you don't have to social distance, you don't have to do the things that we've all learned about over the last year. So it's important, again, as we're getting very, very close. As Dr. Bogan said, we're seeing a fourth wave, the cases are going up. And the reason is it's the relaxation of mask wearing and distancing and the things that we know that can occur. So, baseball season's opening up, more sports are going to be happening at all levels from young kids all the way up to, the Pirates. So again, we just want people to remain vigilant on what they're doing. I also wanted to add one other thing. I know there's a question that came in before regarding, and I normally don't go off of COVID, but there's been some incidents at the Liberty Monitor, our air quality monitor, over the last 2 to 3 weeks, where we've had numerous episodes in which the monitor has risen above the level that's acceptable, which is very frustrating because after 3 years, the 3-year window that we finally made attainment at that monitor, we could all take a lot of work and a lot of pride in, certainly Dr. Bogan and her team and even, predecessor to her. But, we've had, whether they be inversions or whether they be other weather events that we've seen, the latest one being last night. So I have asked the health department to really be as vigilant and looking at what's going on, whether it be notification, and our partners, particularly U.S. Steel, that when they see these things happening, we need, again, it's partnership. We need them to reduce whatever the levels are that happens, whether it's production or whatever it might be, to work on those issues. They will continue to go through the process as far as making as vigilant as they can the regulations, but there's also limitations that the EPA and the DEP and other state and federal regulators have done. So I just wanted to address that issue as well. Again, partnership, whether we see it with COVID, whether we see it with our environmental issues out there. When we partner and we work together, we can really make some great strides, great improvement.
This next question is from the Pittsburgh Business Times and relates to something you did already touch on, but just as a follow-up question, the increasing number of COVID-19 cases, do you believe that those are primarily in people who haven't been vaccinated?
Yes, so that's an important question. The vaccines are remarkably effective, and all the cases we're seeing are in people who are not vaccinated. There have been a small number of breakthrough cases, but the percentage is very small.
This next question is from WTAE. Do you have any advice for workplaces that may be bringing more employees back into the office as vaccines become more available?
Yeah, I think that the state has put out really clear guidance on workplaces, and I would refer you to the state guidance and ask people to follow that guidance.
This next question is from Print. With vaccines opening to restaurant workers after restaurants are increasing capacity, and vaccines opened to everyone on April 19th, but the work from home mandate dropped on April 5th, how can you keep those workers who are not line jumpers safe?
So I'll just remind people that restaurants have been open. Right now they're increasing in capacity. And it's important for us all to keep each other safe. For the patrons, they need to protect the staff by wearing their masks appropriately, keeping physically distanced, limiting their exposure that they are exposing the servers, and vice versa. Our servers need to be wearing properly fitted masks and following all the guidance as well. So I think if people have mutual respect for one another and follow the rules, that's really important. I also want to encourage anyone and everyone to get vaccinated as soon as they can, so please sign up. And also that our field response team and our food safety teams are continuing to do their work to educate. That's their first job, is really to provide education and to help people put in place proper strategies to keep everyone safe. And then when that doesn't work, we use enforcement. But our goal really is education. And that work is ongoing every day. We call businesses where we have cases, including restaurants, and provide them support and education.
And that was the final question. Is there any closing remarks?
Leave it to the county executive.
Well, thank you, Dr. Bogan, for the continued work. And as Dr. Bogan indicated, we were delighted that Governor Wolf and his team came today to again partner with us as they have been throughout the pandemic and making sure we get enough vaccine to get into the arms of folks. And again, congratulations to the state for being ranked #1 by the CDC in percentage for large states in the nation. It's quite, and it takes a lot of partnership for that to do it. The other thing that Dr. Bogan has talked about, as well as Governor Wolf today, is equity. And Dr. Bogan and her team have really worked hard to make sure that the vaccine distribution is equitable to folks across the spectrum in underserved communities. As she talked about getting into our homebound seniors as well as other areas that might not have as easy access as others. We'll continue to work along those lines, again, with all of our partners across the county and across the region to do that. And again, it's all the partnership that we have. So let's, again, the weather's getting nice. Let's go out and enjoy the recreation and being exercise and healthy and getting out as we've been homebound for so long. But continue to wear the masks, continue to distance, and when you have a chance to get that vaccine, please do so. The more people we get vaccinated, the quicker we'll get back to the freedom that we all want to enjoy. So have a good week. God